I want to just say thanks again to everyone for coming on a Friday. We're going to be doing these every Friday to give you a glimpse into the wonderful treatment partners that RecoverWell works with today. We are now serving, I think we're going to hit 100 hospitals this week. So growing fast. Yeah. And great things happening. And I'm really happy about the partnerships that we have. And I'm really excited to introduce you to Emerson Groom today from Demore Mental Health. They have 4 beautiful homes in Orange County. The facilities are home-like settings. They don't feel institutional or cold. They're very warm. They have an awesome team. I've met with all of them, of course, and I love their program. They do this great sort of open community night that I'll ask Emerson to give you guys details about, that I think is just incredible. And without much further ado, I'll turn it over to Emerson because he'll obviously be able to tell you so much more than I can. But thank you again, everyone. And we'll do our raffle at the end of his presentation.
Nice. And thank you so much for the warm introduction. Hi, everyone. And more importantly, happy Friday. You made it. So yeah, I'm just full transparency. I'm having a little bit of difficulty with my screen sharing. But I'd love to kind of give you guys the nuts and bolts of who we are and what we do. So we're a primary mental health residential treatment facility. And like Amy said, we have 4 6-bed houses. We treat a wide variety of disorders, anyone coming from depression with varying levels of suicidal ideation, as long as they don't qualify for a psych hold, people in a manic or depressive episode with bipolar. We treat thought disorders, schizoaffective, schizophrenia, personality disorders. We also treat panic and anxiety disorders. And one thing kind of to go on a little side rant about is that with our 4-bed houses, or with our 4 houses, we're really intentional kind of with how we set up each one of those houses to treat different milieus. So generally, we usually have our thought disorder house that's staffed appropriately, and the programming is designed specifically kind of to treat that milieu. We usually also always have a gender specific male and female house. So being co-ed on paper, I just say that clinical does a really, really good job at setting up each milieu where the client's going to feel safe and comfortable and be able to heal. While you're with us, you're under the care of our psychiatrist. You're meeting with them day 1 for initial psych eval, history, and physical. And then you have weekly follow-ups for medication management. You'll have a therapist who you'd be meeting with 3 times a week for one-on-one sessions. One of those sessions can be utilized for a family session if it's appropriate. It's obviously up to the patient, but it's usually something that we encourage. And if families on ROI, we're providing weekly updates and really keeping them in the loop as far as the treatment process. We do 6 to 8 hours of group therapy every day. It's a good mix between your evidence-based therapies, so like CBT, DBT, acceptance and commitment therapy. We do grief and loss, anger management, process groups. And then we have a good mix between like your experiential / holistic stuff. So we do equine therapy once a week. We do sound bath, yoga, meditation, music and art therapy. We have a rotating Friday outing that goes between like Color Me Mine, which is a like therapeutic painting kind of experience. Some days we'll take them on like to get manis and petties. We have a really good rotation of outings on Friday. We do 3 outside gym visits every week. So we're really kind of big on, every kind of component of mental health, from sleep, medication, exercise, diet, nutrition, coping skills, social support. We really want to take kind of every facet of the pie to treat the individual as a whole. One of the other things I'd say we're really big on is this idea of really setting people up with an aftercare plan where they're going to be successful. I know a lot of times people are, when they're going from hospitals to residentials to PHPs to IOPs to sober livings, there's not that much continuity of care or communication between the different facilities. We're really big on setting up what's called like the 1-year aftercare plan. So having a really good understanding of how you're going to walk your first year out post discharge from us and be successful. And one of the requirements to be accepted into our program is that you're going to agree to at least some type of aftercare, whether it be PHP or at a very minimum, at least continuing with a psychiatrist and a therapist. Kind of one of our core philosophies that I think kind of really embodies just everything about us is this idea of gracious redundancy. So kind of how I interpret it, one side is just this unconditional positive regard from our staff, from our clinicians, from our medical team, and then kind of paired with this redundancy, which is this repetitive, loving providing of life-changing information. I know most of us, we probably retain about 5% of everything we hear. So we know it takes a while for this stuff to sink in. And really what we want is for people to have a good grasp of the basics of managing mental health before they leave us. So just to kind of give a little metaphor. So like when you go on an airplane and, the airline stewards and stewardesses are just graciously kind of providing this life-saving information, and they're doing it a variety of different ways. So they have their, you have your little pamphlet in the pocket in front of you that, tells you what to do in front of an emergency. And then you have your stewardess before you take off, who's in the aisle kind of telling you what to do in an emergency. We want to hit you from a bunch of different angles with this life-saving information. And we do that by everyone gets a gracious redundancy handbook upon admitting, and it has a bunch of really cool stuff, CBT thought logs, a bunch of DBT stuff, Brene Brown stuff. It has your aftercare plan in there, social support, your WRAP plan. It's a whole kind of toolkit for your mental health. And then, like I said, we do it through one-on-one therapy and individualized treatment plans, and we do it through group therapy. And kind of just to give you a little better understanding the milieu that we treat. So we're getting a lot of people who are stepping down from inpatient psych holds, okay, for, been on a hold for however many days on a 5150. We're getting a lot of lateral transfers from like SUD detoxes and residentials, where they land, they go through the detox process, and they really, the staff really kind of find that, okay, this person has more primary mental health needs that need to be addressed before kind of going to the next steps. And then we get a lot of people who are in PHP, IOP, whether it be mental health or substance abuse, who have some type of crisis, and they need a safe place to go and stabilize. That's what we do. We've been in our lane for about 8 years, and I can say confidently we're really good at what we do. One thing I want to pitch that Amy had mentioned earlier. So we host a community mental health night. There's not a lot of resources for support groups for mental health. I mean, I know there's like NAMI, but kind of I went on the website and I've really found that it's more kind of suited towards family members, and there's not that many, like I said, not many resources for mental health support groups, but we host a community mental health night. It's at Crosspoint Church on Mondays, and that's in Huntington Beach, from 6 to 7:30. The best way I can explain it, it's a clinician-led support group. So a clinician will start the meeting off with a 10-minute share. It can either be like a personal share or share on a topic of their choosing. And then the meeting's open for open share. There's people there willing to sponsor. It has a loose kind of like 12-step foundation. Like they read the 12 steps of mental health to begin, but it truly is an open share. All are welcome. And there's probably about, I'd say anywhere from like 30 to 60 people going on any given night. So it's free community support for anyone, or any family member of someone struggling with mental health issues. If you have any more questions about that, feel free to, put your email in the chat, and I'd be happy to follow up with, some flyers on specifics.
I have a couple of questions, Emerson. So first of all, I want to say that on my last visit, I went over that handbook that you were talking about earlier. We went through that. You gave me like a good, thorough understanding of how you guys organize and manage your treatment. It was amazing, really thorough, great handout that you guys put together for your patients. So I thought that was wonderful. I wanted to ask you about medication management. This is a question I get from the patients that I work with a lot directly. In terms of when patients come to you from the hospital, sometimes it feels like their medications are just kind of crazy all over the place. Like multiple doctors have sort of assigned them different diagnoses, and there just seem to be so many medications. And that's one of the things a lot of my patients will tell me is like, I just feel like I'm on so many medications, or I've tried so many different things. Can you talk about that medication management piece?
Yeah. So, well, I'll say a couple things on that. So one, we have a whole medical team, from our psychiatrist to our psychiatric nurse practitioner to nurses. And one thing that I think's special about our medical team, is our psychiatrist and our psychiatric nurse practitioner, work together, prior to being at our facility for, a lot of years. And the reason I say that is that they have this, a very similar, treatment philosophy. The reason I say that is, unfortunately what I've seen is that, one patient can go to one hospital and they can go to another hospital 2 months later. They can get totally different diagnoses, totally different, medication regimen. And there's not a lot of like just continuity with care. I think our psychiatrist, the best way I can like describe him is like, competent, just, and it's outside of my scope a little bit, but when I see people, getting prescribed medications, I think he does it conservatively and appropriately. We don't do any controlled medications in our care. So benzos, stimulants, opiates, that individual wouldn't be appropriate for our care. If they're open to trying like alternative medications, and all psych meds are fine, just no controlled medications. Okay. And then we also do Spravato, which is the nasal form of ketamine for treatment-resistant depression. Not everyone's going to qualify for that. Of course, you have to have trialed a number of antidepressants and no substance abuse history. But we're doing it in a way where a client's going to sit down with a clinician it's pretty extensive, for 2 hours. and come up with some intentions on what they want to work on and focus on while they're doing that. Yeah, so
You
Go ahead.
guys aren't doing MAT, right?
Yeah, so there's no MAT.
Okay. We're coming up on time. So first of all, I know you were having an issue on your side about sharing your presentation. If you want to send that to me, I'll mail it out to everybody. So I know you were going to put pictures and stuff on there. So feel free to send that to me in like a PDF or a PowerPoint, and I'll send it out to everyone because I know everyone likes to see pictures and videos. Also, the website itself, D'Amore Mental Health, they have beautiful pictures of their facilities online as well. And I'll be sending out this video. If you guys wanted to share it with anyone, you're welcome to. And I'm going to do our raffle here, and so that everybody can get back to work. Did anybody have any questions while I'm doing this?
I see one question: what insurance we accept? So no Medi-Cal, no Medicare. We are in network with a lot of folks. So we're in network with Anthem, Health Net, Blue Cross Blue Shield, United, Oscar, Optum, and also Pathways. Our referral and then our referral process, after we run a verification of benefits, we like to schedule a phone assessment. We also like to do what's called a loved one assessment if possible, especially for like our clients with like kind of poor insight, where we talk to a family member that the client has entrusted to provide collateral information. And then we also, if they're being referred from a hospital, we want the clinical packet. And then once we get all those done, it's submitted to our medical and clinical director for admit approval. And then we can provide transportation as long as you guys are within like an hour and a half of us to our facility.
And Mike asked that question. Mike is from his house, New Creation. I'm going to send you guys a connection because I think he has a patient he wants to talk to you about today. But Mike, just so you know, you can also, and I can work on this with your team, you can also use the platform to refer patients out. So if you need to refer to a higher level of care, IOP, PHP, or primary mental health, you can put the patient into the system and you will most likely match that patient to D'Amore Mental Health. They take almost all the same insurances that you guys do, except for you guys also take Medi-Cal. So I'll connect you guys right after this meeting by text, if that's okay. I find that's
perfect.
quicker than email. All right, let me choose a winner here, and then I'll leave this open if people want to stay on with Emerson and ask some questions. Okay, who do we have? This is my favorite part. Okay, Mandy Herrera, are you here? Okay, Mandy's not here. Let's see.
And
We have Sarah Wu. Okay, not here. I saw her jump out. Okay. Alicia Abate. Woo! Okay, Alicia, I will email you your Amazon gift card, and everyone else will get their coffee gift card from Emerson directly. So Emerson, I'll send you those emails today. Yeah, and if anybody wants to stick around and ask questions of Emerson, go for it. Okay, looks like all the questions are answered. Okay, awesome. All right, Emerson, I'll shoot everything over to you. And you guys, if you have any questions, you know where to reach me. Everybody has my cell phone at this point. Yeah, have a beautiful weekend. Enjoy the wonderful weather.
Thank you.
Thank you.
Great information.
Bye.
Guys.
Bye.